For all the latest updates, subscribe to News9.
India is one of the worst affected countries in the world. IMA has already sounded alarm after Kerala government said community transmission has begun in the state. Doctors and experts have cautioned that the situation might get worse if we do not take enough preventive measures.
This is now an exponential growth. Every day the number of cases is increasing by more than around 30,000. This is really a bad situation for the country. This is a bad sign. It now shows a community spread.
Looking at these developments, ICMR DG Dr. Balram Bhargava and Union Health Secretary Preeti Sudan have written to all states requesting them to ramp up testing. In the letter, they said that a strategy has been devised for increasing COVID-19 testing. They said that there has to be coordination between the state governments as well as various departments in the country. A strategy to enhance the COVID-19 testing in the country has been devised, which requires a coordinated effort from the state governments as well as various departments of the central government and scientific bodies such as ICMR, DBT, DST and DSIR under the union government. The ICMR Director General asked the states to add more labs and enhance the existing capacity of the approved labs. Increasing the testing capacity may be achieved by adding more laboratories for COVID-19 testing and enhancing the existing testing capacity of the approved laboratories. ICMR suggested that RT-PCR machines available with research and educational institutions should be temporarily deployed to district hospitals. The apex body said that this temporary arrangement would fulfill the gap in shortage of machines to conduct tests. Union Health Ministry also requested the state governments to prepare a roadmap for such redeployment. The state governments are requested to prepare a roadmap for such redeployment by factoring in the manpower requirements. ICMR requested the state governments to plunge into action and report their requirements with respect to increased testing in the states. There are 261 private medical colleges recognized by the MCI. Out of these, 76 have been approved for testing and another 185 private medical colleges with 2 RT-PCR machines can be added to the testing network. The states shall immediately send the request for their registration as per the criteria of the ICMR mentioned in the link provided. ICMR Director General Balram Bhargava opined that in the coming days the situation might get worse. As of 21st of July, there are 3,90,459 active cases in the country and the recovery rate stands at 62.7%. A few days ago, ICMR had asked the states to ramp up antigen testing in all the districts. The ICMR Director Balram Bhargava requested the state governments to follow the protocols given to them while conducting antigen testing.
Algorithm for interpreting the antigen test should be followed, wherein all positives can be labeled as true positives and symptomatic negatives should be subjected to RT-PCR. All testing points should be appropriately linked.
The ICMR Director General further requested the state governments to share the data with the ICMR.